So if you are watching this, maybe you have been told by your doctor that you need medicine for your high cholesterol, and maybe that news has left you feeling discouraged. Trust me, I understand. Frustrated even, or even just scared. Maybe you're already, trying to eat better, you started exercising, like legit, you are doing your best. Or maybe you have done everything you know how to, and your numbers are still, just sitting there. They're not really doing much. Or maybe you have seen your loved ones. It might be your mom, your dad, somebody you love, take medications for years. And you wonder, is this my future too? Or is there no other way? My name is Dr. Izie. I'm a GP. I'm a lifestyle medicine physician. And one of my biggest passions is to help you understand what happens inside your body so that you can be powerful, you can take full charge of your health, and you can live your best life. One of the key factors that make doctors prescribe medications for you when you have high cholesterol is not just based on your cholesterol number. Yes, your cholesterol is high, but that's not the only reason why we give medications. So first of all, your bad cholesterol that we talked about before and your triglycerides levels, when they are too high, so if your bad cholesterol is over 160 milligram per dl and your triglycerides are over 200, your risk is starting to climb. So we treat based on risk. And if your LDL, which your bad cholesterol is over 190, medication is strongly advised. And if you already have things like heart disease, diabetes, high blood pressure, or if you've already had a heart attack, sometimes some people have had a stroke, or they have conditions like, the things I mentioned before, you definitely need medication. Another reason why medication would be prescribed is if you are diabetic. So your LDL needs to be kept below 70 to avoid serious complications. If you're a heart disease patient, your LDL should also be below 70 to prevent further blockages and further complications. If you're a hypertensive patient, your cholesterol multiplies your risk of getting heart attacks and strokes. So that's another reason why we want to keep it low, and that's another reason why we will give you medicine. Another reason why we would give you medication is maybe your lifestyle changes haven't made any difference. Or, like we talked about before, your genetics are working against you. And some people, to be fair to them, they do everything right. They eat healthy, they regularly exercise, but their cholesterol still stays high. Why? Because of the genetics. Some people are born with something we call familial hypercholesteremia. And this is a condition that they were born with. It was inherited. And in this situation, their liver does not remove the bad cholesterol effectively. So in some people's cases, high cholesterol runs in your family. So medication would be necessary in this case, because no matter how well you eat or you move, you still need help bringing those cholesterol levels down. So medications like statins, they work by reducing how much cholesterol our liver produces. And they help our bodies remove all the excess bad cholesterol. That's what statins do. And you know that medications will reduce your cholesterol numbers, but it doesn't actually fix the root cause. And that's what I'm so passionate about. If you have to take medication, why not? But I want us to focus on fixing the root cause. So it doesn't clean out your arteries. It doesn't stop inflammation. It doesn't replace healthy habits. When there is an fire alarm going on, it's like you go and turn off the fire alarm, but you don't stop the fire. That's the kind of thing that medication does. Do I say that medication is bad? No. There are times when wisdom calls for medical help. And as a doctor, you definitely need medication when your body calls for it. When your cholesterol is dangerously high, the risk of a heart attack or a stroke is far too great to ignore. In Mark chapter 2, verse 17, Jesus himself said that it's only the sick that needs a physician. There are moments where we must use the tools that are available to us, and medication is one of those tools. You know that many people assume that once they start medication, the problem is solved. That's very concerning. But here's what I want you to understand, that there is no pill that can replace what your daily habits will do to your heart. Medication can bring down your numbers, all well and good, but it will not cleanse out your arteries. It won't remove inflammation, and it won't make you healthier. Only your choices can actually do that. Let's use this amazing analogy. Imagine your health is like a garden, a beautiful one. Medication can what? Take out the weeds, but it won't fix the soil. So if the soil is dry, if it's, nutrientless, if there is a word like that, the weeds will continue to come back. But your daily habits, what you eat, how you move, how you care for your body, these are the things that would change the soil. And these are the things that will do what? Help you create a real and a lasting healing. You know, some people watching this today, unfortunately, they might just feel really desperate. You know, they don't want to take medication anymore. Maybe others have started to take it, but they feel guilty about it. So if your doctor has recommended medication, don't see it as a failure. See it as a tool, a temporary support while you work on the real solution. You change your lifestyle from the inside out. You begin to work on those little things day after day. But if you're already on medication, don't stop fighting for your health. Continue to fight those lifestyles, those habits. Don't let the pill replace your discipline. Keep making the right choices, because every change you make strengthens your body, regardless of what's in your medical cabinet. At the end of the day, we do what we can, but we trust God with all of the rest. Proverbs 3:5-6 tells us that trust in the Lord with all your heart and lean not on your own understanding. Our bodies are designed for healing, but we must walk in wisdom. We must care for what we have been given. That is our responsibility. Remember that no matter where you are in your health journey, whether you need medication or you don't need medication, what matters most is what you do next from here. So I challenge you today. What is that one step that you can take right now to improve your health? One step, one habit that you can actually commit to that moves the needle towards healing. Drop a comment below and tell me, what's that one change that you are ready to make today? And if you need more guidance, stay with me, because I am here to help you walk this path to better health. So thank you for watching. If you have found this information very helpful, please like, comment, and subscribe, and turn on your notifications so that you can get more information as I upload. And don't forget to comment down below so I can answer your questions and we can continue this journey together. Thank you.